Let's face a difficult reality together. Every night, when the alarm clock goes off around 3 in the morning, it's not because you woke up early to exercise. It's because you have to go to the bathroom. Do you think that frequent nighttime urination, a weak urine stream, or sometimes a feeling of lack of control is simply an unavoidable part of getting old? Most men think so, and that is the biggest problem. The reality is, prostate cancer is the second most common cancer in men, especially after the age of 60. But here's the frightening thing: it is a silent killer. In its early stages, its symptoms often perfectly overlap with benign prostate issues like benign prostatic hyperplasia, BPH, that most of us know about. The 10 subtle warning signs you are missing here is the astonishing truth. There are up to 10 subtle signs that many men ignore, attributing them to age, but they're the early warning bells your body is sending you. I'm not saying we should panic. Quite the opposite. We need to be alert and take action. Early detection of this disease can completely change the situation, turning it from a threat into a manageable, even curable, condition. I have spoken with many men, from hardworking immigrants in New York to leisurely retirees in Florida. They all regretted ignoring one or two of these signs. In this video, I will not only list those 10 signs, but I will explain the medical reason behind each one and point out the subtle difference between benign symptoms and signs that require immediate checking. My goal is to help you recognize that red line so you can take control of your health and continue to enjoy these wonderful years with your children and grandchildren without living in anxiety. Let's discover now the 10 subtle signs that most men over 60 are missing. If you have stayed here, it proves you are genuinely concerned about protecting your wonderful years ahead. I want to emphasize this. Prostate cancer is often a very slow-growing disease. Recognizing these signals early is your strongest weapon. Never wait until the symptoms become obvious and painful. We will explore these 10 signs together, and I will clearly differentiate which warnings to heed. 5 signs related to the urinary tract. This group of signs is the most easily confused with benign prostatic hyperplasia, BPH, but there are subtle differences you need to know. Weak urine stream, you find you need more time to urinate, and the stream is no longer strong and forceful like before. BPH also causes this, but if your urine stream suddenly weakens significantly in a short period, or if it becomes a trickle almost impossible to start, it's a sign that there might be a tumor forcefully pressing on the urethra more than typical BPH. This affects your privacy. You don't want to spend 10 minutes in the bathroom every morning. Feeling unable to empty the bladder completely after urinating, you still feel your bladder is not completely empty, a very uncomfortable sensation. Both BPH and cancer can cause this. However, if the amount of residual urine is large, it can lead to recurrent urinary tract infections, UTIs, a secondary issue that requires deeper examination to rule out a malignant cause. Did you know that residual urine is the perfect environment for bacteria? If you frequently get UTIs with no clear reason, book an appointment. Increased nighttime urination, nocturia, you have to wake up 2 to 4 times or more every night to go to the bathroom. Yes, BPH is the most common cause. But if this frequency is accompanied by any other sign on this list, or if it happens even after you have limited fluid intake in the evening, it's a signal you cannot ignore. Sleep loss from waking up to urinate not only makes you tired, but also affects overall health. Difficulty starting urination, hesitancy, you stand at the urinal, ready, but need a long time and straining before the flow can begin. This is a classic sign of obstruction. If this condition is worsening and not responding to common prostate medications, you need a comprehensive medical evaluation to rule out a developing cancer. Pain or burning sensation during urination, dysuria, you feel pain or a burning sensation when urinating. This is often a sign of infection. However, if the pain is prolonged, does not disappear after common infection treatment, or if it is accompanied by a dull ache in the pelvic area or lower back, don't hesitate. I remember the story of Henry, an immigrant German engineer living in Ohio. He thought the slight burning sensation was just due to drinking too much coffee. Fortunately, his wife urged him to get checked. It turned out to be a tumor just starting to develop. He acted in time. 5 subtle signs that most men ignore. These are the signs men often attribute to completely different causes, but they can be signals from cancer at a more advanced stage. Blood in semen or urine, hematospermia/hematuria, detecting pink or dark red blood in semen or urine. While not always cancer, this is an extremely serious sign that cannot be ignored. The prostate gland is located close to the urethra and the ejaculatory ducts. The presence of blood is a clear signal of internal damage. Whenever you see blood, see a doctor immediately. Persistent lower back or hip pain, a dull, uncomfortable ache that is not related to injury or heavy exercise. Prostate cancer tends to metastasize, spread, to the bones first, especially the spine and pelvis. If you have back pain and cannot find the cause through physical therapy or chiropractic, ask your doctor to check your PSA level. Pain in the pelvic area or testicles persistent, unexplained pain in the area between the anus and the scrotum, perineal area, or testicles. The prostate gland is located right here. A growing tumor can put pressure on the nerves and surrounding tissues, leading to vague but continuous pain. This is a subtle sign because many think it's muscle pain or sciatica. Unexplained weight loss, you find yourself losing significant weight over several months without changing your diet or exercise routine. Unexplained weight loss is a classic sign of many cancers at later stages. If you lose more than 5% of your body weight within 6 to 12 months without trying to lose weight, this is a red flag. Swollen legs, swelling in feet and ankles, unexplained swelling of the legs, feet, or ankles. The warning: this sign is often attributed to cardiovascular or venous disease, but in the case of metastatic prostate cancer, tumors can compress the lymph nodes or veins in the pelvic area, causing obstruction and swelling in the lower body. Many gentlemen only discover their cancer after seeing a doctor for leg swelling. Don't be one of them. Remember, having these signs does not mean you have cancer, but it does mean you need to get checked early. This is not the time to try unverified supplements. When you see your doctor, don't just say, "I have trouble urinating." Clearly list your symptoms, including back pain and the frequency of nighttime urination. And most importantly, ask them to perform a PSA, prostate-specific antigen, test and possibly a thorough digital rectal exam. If this information is helping you gain clarity about your health, hit the like button on this video right now. That helps us spread this life-saving message together. We have together reviewed the 10 subtle signs of prostate cancer. I hope you have internalized the subtle difference between the 9 signs and signals that require action. Your alertness today is the best insurance for your health tomorrow. Remember, in the fight against this disease, early detection is the golden key. Don't let shyness or the thought that it's normal at this age hold you back. Now is the time to act for yourself and your loving family. I want to ask you one question. Of these 10 signs, how many have you attributed to old age without ever mentioning them to a doctor? Comment that number below, e.g., I ignored 3 signs. We are in this journey together, and your sharing might save another man's life. Subscribe to the channel, go ahead and hit the subscribe button and turn on notifications. This ensures you will never miss any health strategies built on scientific evidence, in-depth advice specifically for men in their 50s and 60s who want to live an independent, high-quality life. Share this video. Please, I urge you, share this vital video with your close friends, your brothers, or anyone you think might be telling themselves that waking up to pee at night is normal. Sharing this information could be the most valuable gift, a life-saving act you give them. Let's build a community of strong and alert men together.
Continue the journey. Don't stop here. Prostate health is an ongoing journey. I've prepared a follow-up video in the playlist now showing on your screen, titled 5 Foods to Naturally Boost Prostate Health. That video will help you reinforce your defense system right from your dining table. Thank you for listening, for trusting, and for taking action. Remember this, alertness is your greatest strength. Be strong, be alert, and take care of yourself. See you in the next video. Naan ba mentor